I am getting on a bit, aren't I?
Are you?
Yes.
What do you mean?
Well, it's a 90 this year.
It's the 90 this year. You're looking good.
Am I?
Yeah. My name's Dr. Lindsay Crockett. I'm a GP in rural Suffolk, and like all practices across the country, we look after patients from birth till death. The intention of this film is to encourage all of us, not just GPs, community workers, healthcare teams and families, to have conversations early on with people who may be towards the end of their life. I want to encourage us all to listen, understand and write down the choices that a person may have expressed regarding their care at the end of life, whenever that may be. To do this, we are using the RESPECT form. It's important to stress that the RESPECT form is not the same as a resuscitation form. A person may be for resuscitation and yet still have a RESPECT form completed. This form can be filled in by the patient and anyone they choose to be involved in their decisions. And whilst it's not a legal document, it does need clinical sign-off by a senior responsible clinician. That person does not need to be a doctor. It can be any clinician who has the competence as agreed by their organisation. So why are we doing this? Why are we using a RESPECT form? What's wrong with what we're doing already? We're not so good at talking about death and dying, and 70% of our population express a wish to die at home, but the majority of those people will die in hospital. And that could be avoidable if we have early conversations and advanced plans in place. At the moment, when we think of end-of-life care, we tend to only think about resuscitation status. And resuscitation is simply the decision we make when a person's heart stops. It tells us nothing about what to do before the heart stops. It doesn't tell us where a person may choose to be when their heart stops. I visited 3 patients who were willing to start the RESPECT process. Maggie was diagnosed with dementia 4 years ago, and her husband Peter is worried about her future care. We explore her capacity to make decisions and share and document conversations about her end of life. Dorothy is 89 and lives in a care home. She is relatively healthy but becoming increasingly dependent on care staff and, like all residents of care homes, has the right to be involved in decisions around her future care. Anoop is 46 and has an incurable brain tumour. It was clear from recent hospital letters that he was developing symptoms that may soon result in an inability to make decisions for himself. When you last had an appointment with Mr. Chow, your oncologist, what did he say to you? Has he given you any idea of what to expect in the future?
He explained that it didn't work, the chemotherapy didn't work.
Oh, okay. Did he tell you what the CT scan showed that you had last month?
Yes, you know.
I know. I wanted to be sure that you knew.
Yes, I know.
Okay.
I accept that I'm dying.
So it's important that I understand to be able to document for other people involved in your care what is important to you. We know this cancer is growing. We know it's not curable.
It's not about having specific ideas because I don't know what is on offer. I just know that I need something more than nothing, which is what I've got now. I need to know what is on the table, what isn't on the table. I have a finite amount of time left. I mentioned last week that I would be coming to talk to you about what really matters to you. When we think about your future, what's really important to you?
What is important? Well, I don't want to go on living like this.
What do you mean by that?
Well, if I'm going to get worse, then I don't want to go on. Because I can't see any point in, you know, you can't go out, you can't really enjoy life. So.
Now, the form I'm talking about asks about what your choices around care are. So it's asking things like, if you needed to go to hospital, would you choose to go to hospital at any cost, or would you agree to go to hospital if you had something like an infection that might be treatable? Have you got any thoughts about hospital?
You know, something like that, but
Yeah.
not if there's not really much hope of you living on.
I hear
I
you.
don't see the point of it, really.
No. I'm understanding that you have quite clear views about Maggie being in hospital.
It's the last thing that I would want for her. She's been recently and she hated it, and we decided that that would be an absolute last resort.
Yes.
That we want to be at home,
Yes.
and if we're talking about the end, in our own beds together. And I promised her that that's what I would do.
I see. And Maggie, I just heard you nod your head when I used the word hospital.
Oh, hospitals,
No.
don't like them.
You don't like
don't
them.
Don't like them at
No.
all.
No. When we spoke on the phone, Peter, this is the sort of feeling that perhaps you have on Maggie's behalf, and that Maggie expressed before she lost capacity to make decisions for herself. As the power of attorney, you're her advocate, Peter. And it's really important that you don't feel responsible for making clinical decisions, but involving Maggie and asking what your thoughts are around her care is essential for us to be able to make these advanced plans.
So, and how does that work?
So that works, meaning that you don't need to sign anything. There's an option to sign to show that you've been involved in these decisions, but ultimately, after a conversation that we translate onto the form, I give its clinical sign-off. So what I would be writing on this form is the desire for no hospital admissions.
Yeah.
No hospital admissions.
No hospital for Maggie.
Oh, please, no.
That's right. That's right.
That would be good.
What actually we're talking about is advanced plans. We want to make sure that we include you, most importantly, in any decisions that are made about care towards the end of life. Not that you are near the end of life. I really want to let you know. We're not expecting you to go anywhere soon, my lovely.
Sure?
Absolutely sure of it. But it's really good to have these conversations early, before you start to get more poorly or frail or whatever. Anu, would you be willing to look at a form with me, the respect form, so that we could start to think about how to document the conversation that we're having?
Yes, please.
Okay.
Let's do it.
Yeah. Now, right now you have full capacity. If you lose capacity, so when your tumour grows, it is very possible that you're going to find it more difficult to understand things. And so then it's asking who has been involved in making the plan. So I'm going to tick this because it's saying that the person, you, has the mental capacity to participate in making these recommendations and have been fully involved in the plan, and that's really important. Okay. Part of this form is also asking about resuscitation. And resuscitation is the decision we make when a person's heart stops. Do you know what I mean by resuscitation, Maggie?
Big word.
Yes.
Well, making everything brighter, better.
Yes.
Yes. Like renovating and all those things where
Yes,
you
Maggie.
paint the house and brighten it all up.
Can I ask Peter? Peter, do you understand resuscitation?
I think I do, yes.
Yeah, okay.
Yes.
So resuscitation is around what we do when somebody's heart stops, okay? So in this country, if somebody's heart stops, we would automatically try our best to get it going again, to resuscitate it. Unless somebody has said clearly, please do not resuscitate me, or if the doctors feel resuscitation would absolutely not be in the best interests for a person. It's usually because other organs are not working so well.
Everything's packing up.
Yes.
Yes.
Yes. And what's important to know is if we did attempt resuscitation and it was successful, that then begins a new journey of treatment, because you'd have to go to hospital to be able to correct the cause of why the heart stopped in the first place. Unless the form has a signature in that particular box saying, do not attempt to resuscitate this person. There's been a conversation exactly around this and plans are in place.
I mean, in that case, I'd say no resuscitation.
So with that in mind, and I agree with your view, and I'm sensing from Maggie as well, as she said, when the heart stops, it stops. By writing all these choices and preferences down, we can do everything to honour those choices.
Well, I understand what you're saying. That doesn't make me overjoyed.
No,
but,
of course
I
not.
understand what you're saying.
Yes.
Yeah.
So would you be happy to share this conversation, these decisions that you're thinking about with some of your family, so everybody's aware of what your choices
Well, I
are?
think they know how I feel.
Do they do? Okay,
Yeah.
that's good.
David's in charge.
Oh, okay, well, that's really good. That's good. And is David the person that we would speak to if, heaven forbid, Dorothy, but if something happened to prevent you being able to make decisions for yourself, would it be David that you would want
Yes.
us to speak with?
David
Right.
is in charge of
Right.
everything.
Well, that's also clear.
This is for you, Anoop, to consider whether you would like Sarah, for example, or somebody close to you to sign to say that they've been involved in discussing your choices with you. This is up to you who you would like to fill this in.
Do we need to do this now, or?
Well, we can do this now, but I'm inclined to let you have a look at this form,
Okay.
share it with Sarah, and start to fill it in, and then I will complete it. I will complete it with my signature here and my signature here.
Okay.
Okay?
Okay.
I need to have a copy in your medical record, and then it stays with you at all times. All right? And the best place would be to put it back and keep it in here, the yellow folder. So if you ever do need to go to the hospital or for outpatient appointment clinics, anything like that, do take it with you. Circumstances might change and your mind might change. And if that's the case, we review this. We can tear this up and replace it with another one. But it's really important every time this form is reviewed that we at the practice know about it and have the latest version for it. This enables you both to then live your lives fully, being reassured that these things are to be respected.
Yes.
Okay.
Yeah.
Sounds good to me.
Thank you very much.
I hope this film has given you some confidence and competence in being able to start a conversation with anyone that you work or live with who you think may be towards the end of their life. Offer them the opportunity to have a conversation about what's important to them. Ask them, when you think of your future, what's really important to you? And then make sure that those conversations are shared with the healthcare professionals to be able to complete the respect form.